Hi, I'm Dr. Peter Logston, and I'd like to go through a few things that might help you pass the PTCB exam. So this is going to be the first module, and in this module, I'm going to discuss pain. So, okay, so I'm going to talk about pain. First, let's do topical. All right. Actually, what is topical anyway? So topical administration would be when you're applying the medicine to the area being treated. For example, if you have an eye infection and if you apply eye drops to the eye infection, that's topical. If you have ear ache or ear infection or whatever, and you're applying the drops to the ear, that's topical. If you have hemorrhoids, you're applying it rectally, then that would be topical administration. Obviously, if you take a pill for pain by mouth and it has to go through the bloodstream, that's not topical. External use would be when you apply the cream or whatever you're applying to the outside body, not internally. Okay, so topical administration. I just want to go over some products that you will recognize if you see them on the test. So if you see anything that ends in cane, then that would be for pain. For example, if it asks you about benzocaine, so benzocaine, you'll see that in all kinds of products for for burn pain, for dental pain, like Orajel, Ambrosol. It's used for could be used for hemorrhoids, and lidocaine are used for the same things. A lot of times you'll see the viscous lidocaine uh, liquid that you use for sore throat, and when there's Dibucaine, that's often used for hemorrhoids. And so you get the idea. Benzocaine, lidocaine, even let me see. Oh, Novocaine, for example. With you hear about that quite often with dental procedures, but these are the ones you see over the counter most often. Okay, um, and then of course, there's the over the counter um, painkillers like a um, Bengay, there's a Tiger Balm, and there's a lot of different products, and most of them have pretty much the same ingredients. Usually, you'll see menthol. Um, that's a common one. Sometimes you'll see methylsalicylate. There's a product called Myoflex too. That's another one. Flex. Sometimes you see some of the ingredients. There's trolamine salicylate, or what's the other one? Methylsalicylate. And whenever you see the word salicylate, you'll know that it's related to aspirin. So if you're using a product that has a salicylate in it, and if there's an allergy to aspirin, then it's probably not the best choice because it can some of it gets absorbed. Okay, and there's a lot of actually little. I'll digress a little bit. It's not for pain, but uh, Oops, I'm sorry. Pepto-Bismol. What do you think that is? That's bismuth, subsalicylate. Subsalicylate, right? So what is it? It's aspirin. So can you give Pepto-Bismol to a child under 12? No, because there's a possibility of Reye syndrome. And if anybody has an allergy to aspirin, then this is probably what they should stay away from. So if you read the ingredients and you see salicylate, then that's pretty relevant because you could really make a lot of decisions, a lot of therapeutic decisions just by the word salicylate. It has aspirin in it. Okay, so now we're going to go over. This. Okay, now we're going to go over some NSAIDs. And so NSAID, um, it stands for a non-steroidal anti-inflammatory drug. So that means it's not a steroid. It's it works on inflammation. So like ibuprofen, naproxen, those kind of things, they work on inflammation, but they're not a steroid. Steroids also work on inflammation, but we're just saying these are not steroids. So aspirin is non-steroidal. So the 81 milligrams, just so you know, which is used to be considered baby aspirin. They don't call it so much baby aspirin anymore because you don't give it to babies, and that's might be what people assume that you do. But it's low dose aspirin, and some people take it daily just to prevent heart attacks and strokes. Um, and it also comes as 325 milligrams too. Aspirin is not used as often because it hurts the stomach. But if you're going to do aspirin, you know, 1 to 2 every 4 to 6 hours is normal. But most people use it to as an antiplatelet. And I'll go over what antiplatelet versus anticoagulant means in a little while. And then, of course, there's the naproxen. And naproxen has the brand name Aleve. And that is typically dosed every 12 hours. So normally 1 to 2 every 12 hours. These, by the way, are all better with food. So naproxen and then ibuprofen. That's a real common one. Ibuprofen. So the over-the-counter strength is 200 milligrams, right? It's over-the-counter strength. And the prescription strength, you have 400 and 600 and 800 milligrams. This is usually dosed every 6 to 8 hours. Okay, so we have aspirin, naproxen, ibuprofen, and what am I missing? Ibuprofen. There's also oh, meloxicam. These are usually dosed every day, once a day. And peroxicam, you know, the cam ones are once a day. And then actually what I want to talk about is Celebrex. That's a really important to talk about. So that's a COX-2 inhibitor. So COX-2 inhibitors are important to know because Celebrex works on pain, inflammation, but it doesn't cause, it doesn't affect blood clotting, and it doesn't really hurt the stomach that much. And actually, let me explain why. Okay, so first let's talk about this here. Let me write it down. So Celebrex, we said, is a COX-2 inhibitor. And okay, so what does that mean, COX-2 inhibitor? So COX stands for cyclooxygenase. My my dog just walked in. What's this? Okay, I'm sorry, but okay, cyclooxygenase. Cyclooxygenase is an inhibitor, right? So cyclooxygenase is an enzyme. So enzymes end in ase, and why it's important is because without enzymes, basically your body processes would occur too slow. This basically speeds up a reaction. Without enzymes, most biological processes couldn't happen. So we need enzymes. And this specific enzyme is used to make what's called prostaglandins. So I will explain this. Okay, prostaglandins. So prostaglandins are hormones that are at the site of basically every cell has prostaglandins, and um, they they're a different type of hormone than most hormones. So most hormones, they'll start off in the brain, and they'll thyroid hormone or whatever, it'll go to a distant area. And this one, but this is close to the area that's affected. And what happens is, if you twist an ankle, for example, then the swelling is caused by prostaglandins. It's just your body's response to uh, whatever's happening to it. A woman that has menstrual cramps, that's caused by prostaglandins. The blood the platelets that stick together, that's caused by prostaglandins. The stomach, it has a protective, uh, like a shield almost, a protective area around the stomach. And that's because of prostaglandins. So prostaglandins have a lot of uses, but they also cause discomfort and pain that people experience. So we have, so there's different types. The prostaglandins, there's prostaglandins that protect the stomach and cause the activate platelets. And the in those prostaglandins, so you have COX-1. Okay, cyclooxygenase 1 uh, produces those prostaglandins. The prostaglandins that affect the stomach, protect the stomach, I'll just say. Protect the stomach, and also activate platelets. Okay, so so that's what COX-1 does. Um, so the idea is we want to keep COX-1. We want to cyclooxygenase 1 that helps produce these prostaglandins. We want those. We want that. We don't want the stomach to be unprotected, and we don't want the platelets to not work, right? So the idea is you want something that only inhibits COX-2, not COX-1, okay? There were some other ones. Vioxx was one that used to be on the market. They took it off the market because it was dangerous, actually. It caused a lot of problems. But so if we want to do a COX-2 or so inhibitor, so if we inhibit, okay, COX-2 inhibitor will, if it's just a COX-2 and you leave COX-1 alone, right? But you have a COX-2 inhibitor, then that'll work for pain, but it doesn't affect this. So it won't affect the stomach. It won't cause the stomach to hurt, and it won't deactivate the platelets. So Celebrex is a COX-2 inhibitor, leaves COX-1 alone. So these other medicines that I talked about, naproxen, ibuprofen, those products, and aspirin, whatever, but all of those NSAIDs, those inhibit COX-1 and COX-2. So if cyclooxygenase 1 and cyclooxygenase 2 are both inhibited, then it inhibits prostaglandins, and therefore it doesn't protect the stomach. It doesn't activate platelets, so the blood just continues to bleed. And so if you're going to have surgery, for example, you don't want to take ibuprofen, and you don't want to take aspirin or naproxen, any of those, because those can affect blood clotting, and then the person could bleed a lot. But Celebrex doesn't do that because it only inhibits COX-2. Make sense? And then, okay, and I want to make sure I talk about Tylenol. So Tylenol is not an NSAID because it does not work on inflammation. And it's also the only one that's recommended if you are pregnant. It's not considered dangerous. Of course, you don't want to overdo it. There are cases of a Tylenol overdose. And yeah, you just don't want to overdo it. It used to be 4,000 milligrams a day was allowed. Now they're recommending 3,000 milligrams a day. So um, they're recommending less because they don't want to cause any kind of liver problems, liver damage. And of course, because it can affect the liver, you stay away from alcohol. Actually, it's better to stay away from alcohol with all of the NSAIDs because, well, this will affect the liver. The other ones, ibuprofen, naproxen, aspirin, all the NSAIDs, they can hurt the stomach, and alcohol can make it hurt the stomach even more. And they're all better with food. Tylenol is usually easier on the stomach, but the other NSAIDs, it's better to take them with food. Okay, and I think that is all for now. And then I'll work on the next module in a few minutes. Okay, and thank you and take care.